All right, on this edition of the Franklin Community High School Career Exploration Project, we have with us a nuclear pharmacist from Cardinal Health in Atlanta, Georgia. We have with us Megan Unger. Megan, thank you for joining me.
Of course, I'm happy to do this.
Unger, has anyone ever called you Ungie?
Yeah, actually, let me think back. I got to scratch my head real hard on this one. Actually, you.
Oh, okay.
Nickname that Mr. Powers gave me because he was my cross country and track coach in high school at Tri-West. So
Yeah.
Stuck ever since.
Well,
I guess.
stuck for me, right? No one in Atlanta knows to call you Ungie.
No, and it'll stay that way.
Yeah, we need to change that. All right. So first of all, nuclear pharmacist. Tell me what you do.
What is that? Of course. So basically, with a pharmacy degree, there's many different fields that you can go into. Nuclear is one of those fields. I actually didn't know about nuclear pharmacy when I was in high school. Not until I got a couple years into college did I even know that this type of position existed. So basically what a nuclear pharmacist does is I make radioactive drugs to help diagnose and treat my patients. So my patients are not like your typical patients that come up at a retail pharmacy like a CVS or Walgreens where I see them. I actually don't see my patients because they come to a hospital or a clinic. And so the doses and drugs that I make go out to these clinics and hospitals. They get delivered to them. And then there are technologists that actually inject the drug into the patient. So the unique thing about my job in pharmacy is most pharmacists have a lot of patient interaction. I don't see any of my patients, but I work in an IV room, essentially. It's like a lab, and I make and draw up doses for patients that are nuclear medicine doses. And so if you're unfamiliar with what the term radioactivity means, it's really just a fancy term saying something to the effect of an atom has a lot of energy and it's unstable. And so it wants to release that energy to become more stable. And so when it releases this energy, a camera picks up on this and creates an image similar to what an X-ray looks like. Mm-hmm. So basically, the patient gets injected with the drug, just like an IV, and then they get scanned under a camera. The camera creates an image, and that image will light up where that radioactivity is inside the patient on the scan. And so doctors will use that to help diagnose mostly diseases. We do have some medications that are used to treat patients, but for the most part, it's very much diagnostic. So helping to figure out where is an infection, is there cancer somewhere, stuff like that. So definitely a different avenue within pharmacy, but I have found that I love a lot. So that is what a nuclear pharmacist is in a nutshell.
That is awesome. That's some big stuff right there.
Yeah, it's definitely different. I mean, you work in an IV room, so it looks just like a hospital one. The difference is my hood that I work out of, where I draw up my doses, has lead shielding because I have to be shielded from the radioactivity. So I work behind what we call an L block, which is basically made of lead, and then it has a glass. So I see through the glass and I work around it. Mm-hmm. So throughout the course of this interview, if anyone listening is interested, I would definitely recommend going onto YouTube and just Googling nuclear pharmacy dose dispensing or dose drawing, and you can kind of see what that looks like because it's very hard to describe if you've never seen it before.
Yeah. Okay, so this is kind of a two-part question here. First of all, obviously, as a nuclear pharmacist, they don't just give you that after your high school and say, "Here you go, here you can do this." So, how did you, how did you get your education? What was kind of the route for that? Even if you did go to a subpar school, and then also, what led you to this profession, and especially like the nuclear pharmacy?
So let's address subpar school first.
I get what I said.
I would recommend to anyone. IU is the subpar university, let's be clear. But that being said, more importantly, in order to become a nuclear pharmacist, the first thing you have to do is get a pharmacy degree. So Purdue, Butler, and Manchester University are the 3 pharmacy schools in Indiana. And at Purdue and Butler, and I think Manchester, it's a 6-year program. So you do 2 years of essentially undergrad, or what they call pre-professional, where you do all your general education courses, English, calculus, bio. And then after 2 years, you apply to pharmacy school. And if you get accepted, then you do 4 years in the professional program. At which point you're learning everything pharmacy. So that's the first step, is getting your doctorate degree, as they call it, which is 6 years. And then to become a nuclear pharmacist, you have to have some specialized training on top of that. At Purdue, because it's not a subpar school, they offer an elective course series where you can get part of the specialized training done. But basically what it is you have to have 700 hours of training in nuclear. 500 of those are classroom didactic learning, and 200 is experiential hands-on. So Purdue is one of the few pharmacy schools in the entire country that actually offers this nuclear pharmacy program. And what that means is I was able to go ahead and get my 500 hours of classroom learning done before I graduated. And then I had my 200 hours that I had to do hands-on. I got a little bit in school, but then also once I graduated and got my job, I finished that 200 hours once I got hired. And so that's definitely specific to nuclear, is that 700 hours in order to become a nuclear pharmacist. So that's the kind of the specialized training that we require in this field. Now you said, how did I end up?
Yeah. How did you get in? How did you get, like, what led you to this?
Right. So I got into pharmacy because my dad's a pharmacist. He worked retail at Walgreens for most of his career. So that's how I initially got interested in pharmacy itself. Nuclear, like I said, I didn't know it was even a thing until I was at Purdue, and Purdue offered the elective course series. When you're in pharmacy school, you have to take electives, and you can choose almost anything you want. And so nuclear was one of those. And I knew that if I did it and I finished the course series, that I would get this certification basically in my back pocket. And so since I didn't know what I wanted to do with my pharmacy degree, I thought, oh, well, why not try and see if I like this? Worst case scenario, I graduate with it and I don't use it, and I have it in case if I want to use it someday. And so I went through the course series during my professional 4 years of pharmacy school, finished it, actually was not interested in nuclear at all in my last year of pharmacy school. And what changed that was your last year of pharmacy school, year 6, you do 10 4-week rotations. And so basically the whole point is for you to get exposed to different fields within pharmacy. And I happened to have a rotation in nuclear. And so it was the first time that I had that hands-on experience, because everything I had done with the electives was all classroom lecture based. And so this was the first time I got to kind of have hands-on experience. And so I completed that rotation and ended up loving it, put all my eggs in one basket and said, this is the career for me. I'm going to pursue it. And look at what happened. That's where I'm at today. So kind of different, but super thankful, because if I wouldn't have had that rotation, I definitely wouldn't be where I am today.
Yeah. It's funny how that works out, huh?
Yeah, it's really, I thought I was actually going to go clinical. So in pharmacy, you can work in a hospital. But with that, residency is required for hospital positions. And so I wasn't quite sure if I wanted to, 1 or 2 more years of training. So it wasn't super appealing. But when I went and had that hands-on experience, it kind of connected the dots between what I did and what I was doing on my rotation. I was like, okay, this makes much sense. I do like this.
Yeah. That's awesome. Okay. Yeah. So you obviously love your job.
Yes, I do.
What are some things, though, you do not like about it? What are some of the cons that you would think as far as pharmacy goes?
So
pharmacist would be being.
I would say definitely this would be specific to my specific field in nuclear, is the schedule. So when you're a nuclear pharmacist, you have to work the night shift. That's because a lot of our doses need to get to the hospital by 8 a.m., 10 o'clock in the morning when patients are coming in. And because of that, someone's got to work overnight to make those drugs. So working the night shift for a lot of people can be a deal breaker in this field. So I would say if this is something you're interested in at some point, if you're shadowing or whatever, definitely shadow an overnight shift because you either can or can't do it. So that's one con that I think. Also, pharmacy in general, you work holidays. So like any healthcare field, you'll get some off obviously, but you're going to work Christmas, you're going to work Thanksgiving. You're going to work weekends. So that's something that you have to go into healthcare knowing that that's going to be required position. But also with nuclear, you have to be on call. And so basically what that means is when the pharmacy is closed, there's a pharmacist that has to be on call because you never know when a patient's going to show up in the ER and they're going to need a nuclear medicine study done stat, like right now. And so that can't wait until tomorrow when we dispense a lot of our drugs. It needs to go out now. And so whenever the pharmacy is closed, a pharmacist is on call. If you get called out, you got to go in, basically stop what you're doing and go make that drug and get it out to the hospital. So that's also, I guess you could call it an inconvenience part of this field. But to me, the pros outweigh the cons and you get used to the schedule, especially if this is the first job I've ever had. So I don't know any different.
Right.
So to me, this is what I'm used to. So I don't mind it. The night schedule doesn't bother me. Probably part of that's being young, being able to flip your internal clock. But every pharmacy does a little bit different. My pharmacy, I work 1 out of every 4 weeks of night shift. So once I work the night shift for an entire week. So something I would say those are probably the big cons between pharmacy and just nuclear.
Yeah.
Together.
All right. So I'm going to get you out of here with this one.
Yeah.
I need general advice. Think back to when you were a high school student. What was that 7 or 8 years ago?
Yeah. so yeah, almost 8 years ago.
I need general advice for high school students. Something maybe you wish you knew, just anything like that.
2 things. One is I wish, looking back in college, this has nothing to do with pharmacy, that I would have studied abroad. I have never been out of the country before. And I feel like I wish that I was exposed to more cultures than what I have been up to at this point in my life. And I know a lot of my friends that did study abroad. And, I'm the oldest in my family, so I didn't really have anyone to look up to or say, oh, yeah, you should really do this. But I've had a lot of friends that did it and had great experiences. So I would say if anyone has a chance to study abroad, find someone that's done it that can help you, because that's something that I wish I would have done in college. But also just in general, now that I've been working for about 1.5 years out of college, is if pharmacy or really any healthcare position is of interest to you, leadership is huge. It's hard to get trained for that when you're in college. They train you to know about all the drugs, what it's used for, different disease states. But when you become a pharmacist, you are a leader of a team. And walking in as someone that's super young like me and being a leader of a team that has people that have been working for the company for 30 plus years, and all of a sudden I'm the one that's in charge, some people can have a hard time with that transition. And so I think more than anything, that has been the biggest hurdle for my job. It has not been learning the logistics or learning how to make the drugs. It has been learning to be an effective young leader. And so I think anything that students can do to be involved in organizations, whether it's be in high school or college, it's never too early to start that, because that's the best way you're going to get exposure to being a leader. And so that will help you with that transition once you graduate in whatever field you do. So those are my 2 key things that I wish I either would have been able to plan for a little bit better or that I would have done.
Yeah. Well, that's awesome. Now, to be fair, you were quite the leader on the cross-country team. So,
well, thank you. I appreciate that. But see, leadership in sports is great, but leadership of a team where you got people who are stickler and don't want to change, that's different.
Very true. Very true. So Megan Unger, nuclear pharmacist at Cardinal Health in Atlanta, Georgia. Thank you so much for joining me.
Of course.
It is so good to see you on here. I am so proud of you. You are awesome.
So thanks for having me.
All right.